a public health emergency, in my opinion.
An alert tonight from a local pediatric emergency room doctor about accidental marijuana ingestion by toddlers.
News 8's Emily Leonard here now with her message and this story, all new at 6.
Well, Brian and Sue, this doctor is spreading the word that although legal, the marijuana of today is not the pot of decades gone by. And she's seeing more and more kids getting a hold of more THC than their growing bodies can handle.
I would classify this as a public health crisis. I recently worked several shifts in a row, and I admitted 6 toddlers to Helen DeVos Children's Hospital for marijuana ingestion. 5 of those kids had to go to an intensive care unit.
It's impacting kids from toddlers to teens, overdosing on pot, coming into the hospital with confusion and agitation, or worst case, unconscious.
When you're thinking about the super concentrated forms of marijuana that are now available, and you're thinking about kids who've never used it before or toddlers who are, they're tiny, they absolutely can overdose on pot. They can even die.
Super concentrated THC, like marijuana wax. And too often the culprit, edibles. They're sold in colorful packaging that look like fruit snacks or gummy bears to a toddler.
When a toddler gets a hold of that, they don't eat one like someone who's wanting to get high. They eat the whole package because it tastes like gummy bears.
Dr. Michaels is asking parents to talk to their teens about marijuana and to keep it not only out of reach, but locked up. She's also asking for honesty when their child does get into marijuana.
If your child ingests marijuana, come to the emergency department. Don't wait at home to see what's going to happen. And these young toddlers who ingest this, the drug effect can last for over a day. So please bring them straight in. The sooner we can help your child, the better off they'll be.
The Marijuana Regulatory Agency calls for child-resistant packages or containers. Dr. Michaels hopes her warning will catch the attention of lawmakers that they might call for child-proof packaging on marijuana edibles.
I think that we will see deaths soon in our community if we don't act quickly to change how we're dispensing this drug.
And again, Dr. Michaels urges people concerned about this issue to contact their state representative to demand child-safe packaging on marijuana edibles.